So hypertension is a disease that is treatable, and psychological problems also exist together. So we're going to look at the link between psychological factors and hypertension. How can we do a better job of managing both? Take it away.
So in this webinar, we'll be going over sort of four areas: socioeconomic status, stress, emotional states, so anxiety, depression, and how social support all relate to hypertension. And we find that this is important because, fun fact, for every 10 millimeter mercury decrease in systolic blood pressure, you can significantly reduce your risk of cardiovascular disease and coronary heart disease. So, mitigating some of the psychosocial factors can help in potentially alleviating hypertension or even addressing it.
To me, this is one of the most important slides from a medical perspective. We know that hypertension kills. And look at this, is that, people say, what's my blood pressure? Well, blood pressure fluctuates throughout the day. There's multiple ways of measuring it. And I think you do yourself a disservice. So I remember doing a webinar with Simon a year or two ago, and we measured my blood pressure. During the webinar, it was around 180 over 110. He got nervous. I didn't get nervous because I knew I measure my blood pressure on a regular basis at closer to 120 over 80. Also knew that I had a 24-hour ambulatory blood pressure monitor. And during stressful events, blood pressure goes up. But this is important, is that everybody deserves to have their own blood pressure machine or to measure their blood pressure on a regular basis. Many people who have high blood pressure may not know they have it. And most people, or many people that have hypertension, may not be properly controlled. Now, the best blood pressure is 110 over 70. I'll repeat that. Best blood pressure is 110 over 70. Some days your blood pressure is going to be 90. Some days your blood pressure is going to be 180. It's the average blood pressure that's most important. And what you summarized here is randomized data sets. That's the largest quality information. And here there was over 500,000 people, 613,000 patients that were included for every 10 millimeters reduction. So if you have a blood pressure of 140 going down to 30 to 130, you decrease the chance of a heart attack by about 20% or so, stroke by about 30%, heart failure by about 30%, and chance of dying by about 10%. That's pretty impressive data. Um, and and if you don't have blood pressure variability, it means you're going to die soon. Blood pressure should go up and down. So if you go to the dentist's office and you get the bill and you're a little bit scared, I don't know. I go to the dentist's office, and I hear that drill there. I don't feel too good, right? My blood pressure goes shooting up. Um, so you have to, and we have many videos on how to measure blood pressure in a relaxed fashion. So no coffee for a half an hour. Your feet are flat on the ground. Your back is straight. You're relaxed. You measure. You put your arm on the coffee table and you measure your blood pressure with an empty bladder. And you do multiple readings of that, at least three at a time. The first one will be a little bit higher. Um, and we can show you some of those videos about that. So please, please, please know your blood pressure and do it often. Tell us more.
All right. So now we're going to talk about the influence of socioeconomic status on hypertension and what exactly it is. So socioeconomic status, it refers to a person's position in like the overall social hierarchy as determined by a combination of factors, whether they're economical or social. So some of these factors, you know them as income level, education level, occupation, everything that sort of intersects to form your social position in society. And the usual range that we refer to is high socioeconomic status, middle socioeconomic status, and low SES. So it's correlated with the working class and people in the poverty line. And so we can sort of look at the overarching influence of socioeconomic status with four main findings. So people of low SES are more likely to occupy educational, occupational, residential, and recreational environments that are less health enhancing and promote sort of less health adhering behaviors. Frequent exposures to stressors and few resources uh, People with low SES tend to have high exposure to stressors and low sort of resources to help with these accumulated stress. So you're just building up and testing your emotional resilience continuously. Racial and ethnic differences in SES are large and likely to contribute to racial/ethnic differences in hypertension, and high levels of anxiety and depression symptoms are also often comorbid with chronic illnesses such as hypertension. Now we're going to sort of talk about how race and ethnicity relate to stress. So, discrimination can actually affect the risk of hypertension in many different ways. Experiences of discrimination have been associated with lower levels of adherence to like medications and follow up for multiple health conditions. Discrimination is also positively associated with reported sleep difficulties, insomnia, fatigue, and thereby also increasing hypertension risk. If we look at some of the research, we can actually see this as compared to real people. So, for example, a study by Thomas et al., which had a 25-year follow-up study of medical graduates, found that Black physicians compared to their white peers had a higher risk of CVD with a risk ratio of 1.65, earlier onset of disease, higher incident rates of diabetes and hypertension, twice as high actually, and higher incidence of coronary artery disease, 1.4 times, and higher case fatality. That's 52% versus 9%, which is a pretty large discrepancy. If you look on the right here, we can see the participants as separated into different categories. If we look at the difference between education, between white people and Black people, you can see that here and across Hispanic demographics. If we look at median wealth, so it's 110,000 for white people and then 6,214 for Black people in the US. And for home ownership as well, 72.3 versus 42.1. Interestingly, also, your neighborhood can also contribute to your risk of hypertension. So there's a relationship between neighborhood affluence and how it can be associated with a risk for chronic disease. So low childhood SES and childhood adversity are associated with higher risk of hypertension. So positive neighborhood context may modify the relationship between childhood adversity and cumulative biological risk of chronic disease in adulthood. So if we look at this little graph on the right, so we have three different lines. And if we're to look at the filled in line, so no dashes at all, it has a steeper slope and it shows for lower neighborhood affluence, you have a larger difference between adversity scores.
Next, we'll be talking about stress and hypertension. So just to start with an overview, hypertension or high blood pressure is a major risk factor for cardiovascular diseases and stroke. Numerous studies have shown that psychosocial stressors play a significant role in the development and exacerbation of hypertension. High levels of anxiety, depression, and hostility are closely linked with hypertension. When we experience these emotional states, our body responds by activating the sympathetic nervous system and the hypothalamic pituitary adrenal axis. This leads to the release of stress hormones like cortisol and adrenaline, causing vasoconstriction, increased heart rate, and higher blood pressure. Low socioeconomic status is another critical factor. So SES, SES, socioeconomic status. So individuals with low SES often face chronic stress due to financial instability, limited access to healthcare, and unsafe living conditions. This chronic stress leads to prolonged activation of the sympathetic nervous system and hypothalamic pituitary adrenal axis, contributing to sustained high blood pressure. Occupational stress, including high job demands, low job control, and job insecurity, can also contribute to hypertension. Stressful work conditions activate the sympathetic nervous system, increasing heart rate and blood pressure. Race and ethnicity related stress, including discrimination and internalized racism significantly impact hypertension. Discrimination can cause acute and chronic stress responses, increasing cortisol and adrenaline levels. These responses can lead to higher blood pressure and greater risk of hypertension over time. Additionally, internalized racism can exacerbate these effects, leading to worse health outcomes. Goal-striving stress, defined as the stress experienced when aspirations are thwarted, is another important factor. This type of stress can lead to chronic activation of stress pathways, increasing blood pressure. And then on the next slide here, we see three major stressors that significantly contribute to hypertension. We have chronic pain, financial problems, and poor sleep quality. Let's delve into each one of these in detail. First, let's talk about chronic pain. Chronic pain, such as from arthritis or injuries, can be a major stressor. When we experience persistent pain, our body's sympathetic nervous system is constantly activated. This leads to the release of stress hormones, like we said before, like adrenaline and cortisol. These hormones cause our blood vessels to constrict or narrow, and that increases our heart rate. Over time, this sustained response can lead to consistently high blood pressure. Next, let's address financial problems. Financial stress is a common issue that many people face. This type of stress activates both the hypothalamic pituitary adrenal axis and the sympathetic nervous system. And like we've said before, when these systems are activated, our body produces more cortisol and adrenaline. These stress hormones lead to increased vasoconstriction and higher cardiac output, meaning that our heart is working harder to pump blood. This persistent stress response can significantly elevate blood pressure. Finally, poor sleep quality is another significant stressor that contributes to hypertension. When we don't get enough sleep or our sleep is frequently interrupted, it disrupts our body's natural circadian rhythms and balance of stress hormones. Lack of sleep leads to elevated cortisol levels and increased sympathetic nervous system activity. Additionally, poor sleep reduces the production of nitric oxide, which is essential for vasodilation or the widening of blood vessels. The result is higher blood pressure over time. Ensuring good sleep hygiene and seeking medical advice for sleep disorders are vital steps in maintaining healthy blood pressure levels.
In this section, we will be going a little bit more over the different emotional states and their impact on hypertension. So just starting off with an overview, some key topics in this section will be covering anxiety, depression. We talked a little bit already about stress, but we have not yet talked about anger, and also something that I will introduce in a little bit, known as anger out, and specifically how different forms of anger may contribute to hypertension risk, as well as hostility and irritability as an emotional state to consider for hypertension. So to start off with some numbers, next slide, please. Thank you. So just to start off with some numbers for everyone, for anxiety and depression, it was found in a meta-analysis that symptoms associated with depressive conditions are associated with a 42% increase in risk for the onset of hypertension. And another longitudinal analysis from Jackson Heart Study showed that individuals with a higher anger out level have a 20% increase risk of blood pressure increase. And so what this study actually measured is actually quite interesting, but the anger out score for every individual was based on the proportion of expressed anger as opposed to repressed anger. And so it was shown that those with higher values of expressed anger, as indicated by the anger out value, had this statistic of a 20% increase risk in blood pressure increase. And I will be going over that a little bit more into the specifically expressed anger as well. But next slide, please. And so in general, high anxiety levels and depression are conditions that often coexist with hypertension. And so they're like comorbidities. And something from the previous slide that we learned about expressed anger is that rather than repressed anger, it is associated with an increased risk of hypertension. And this was also consistent with data from the heart strategies concentrating on risk evaluation, or also known as the heart score study. So next slide, please. With all this negativity, we need to talk a little bit more about the positive sides as well. So there is an emerging area of research actually into emotional states, and specifically how we can actually use them to our advantage. So focusing on the positivity techniques, a review by Trudell Fitzgerald raises the importance of two emerging psychosocial factors to consider regarding emotional states, specifically positive psychological well-being, which I will abbreviate as PPWB, and emotional regulation. So many studies show that PPWB, for example, if you are asking what does PPWB look like, it comes in the form of optimism, higher life satisfaction, and emotional vitality. Those are positively associated with hypertension and cardiovascular risk factors. And so if you're wondering, oh, what is this emotional vitality? Now, this is a concept where emotional vitality, you can characterize it as a sense of energy and positive well-being, in addition to be able to regulate emotions effectively. And what we mean by emotional regulation is the ability to monitor an individual's emotions and responses to different circumstances that we have in life or different experiences. And that also influences physical health and improves hypertension risk. Next slide, please. So just going a little bit more into the numbers that this review presented. The recent meta-analysis with over 80,000 people that they studied reported that there was a 55% higher risk of incidence of hypertension for anxious versus non-anxious individuals. Therefore, to talk a little bit more about the non-anxious individuals. Oh, sorry, wait, no. And then there was also an important differentiation between anger and hostility, which was kind of going back to what I was talking about before. And so it was discovered that there was a higher risk of hypertension associated with levels of anger, both experienced and expressed, like outwards, overtly, but not higher levels, but like there wasn't a higher level of a high risk of hypertension associated with hostility, which is defined as the tendency to make hostile attributions or have a cynical attitude. Now, more information regarding PPWB, those with a higher emotional vitality at baseline had a 9 to 11% lower risk of incidence of hypertension for over a decade after follow-up compared to those with a lower amount of emotional vitality, which again is characterized by feeling that energy, feeling that positive well-being, and overall mental satisfaction. As well, just to go a little bit more about the strategies that this review also touched upon. One adaptive strategy that they highlighted in particular is known as cognitive reappraisal, which is a form of like the emotional regulation that we mentioned before. And so it's what cognitive reappraisal entails is altering emotions relating to an event. So if you're just perceiving an event, what it suggests is that you can alter your emotions and for the better by reinterpreting the meaning of the events and reflecting on it, which increases your mindfulness and your positive well-being as a whole. And so this is an adaptive strategy that's associated with healthier cardiovascular well-being, including blood pressure. And so just the takeaway from this entire slide as a whole with the review is that these negative emotions are associated with a higher risk of cardiovascular disease, but positive emotional management and regulation may help the risk of cardiovascular conditions.
All right. So in this section, we're going to talk about how social support and social ties affect hypertension. So in my reading and in my research, I came across this quote that I think sums up what we've talked about and what we're going to talk about pretty nicely. So hypertension is arguably a social disease, precipitated and exacerbated by the environments in which we live, work, play, and learn. We're going to talk more about what we mean by these different environments and specifically the different types of support we have. So there's sort of three main supports that we refer to are emotional support, informational support, and tangible support. So emotional support is intentional verbal and nonverbal ways to show care and affection for one another. For example, when you come home and your partner allows you to rant to them about a tough day at work, that's an example of emotional support. And then you also have informational support. And it's kind of exactly what it sounds like. So when you have a question, concern, you have the ability to actually talk to someone who has knowledge about that. So that could be something as much as going to a doctor or a nurse practitioner for a diagnosis. And then we also have tangible support, which is taking on responsibilities for someone so that they can deal with their problem. For example, having a babysitter so that you can go to an appointment for mental health concerns or even just asking your neighbor to borrow a cup of sugar. These are all the sort of different types of support that allow you to sort of succeed in the environment in which you live in. And so there's been a bunch of research about how social support and these different types of support actually relate to your blood pressure and your risk of hypertension. For example, a study using national health interview survey data for about 30,000 adults in the US aged 25 and older found that both emotional support and social integration were independently associated with decreased odds of hypertension. So the processes, the positive aspects of social ties have been shown to directly enhance health and to reduce the negative effects of stressful experiences on health by enhancing the capacity of individuals to actually cope with stress. So, for example, as I mentioned, having the ability to have a babysitter for when you do want to go to the doctor and talk about your mental health concerns. The study also suggested that emotional support and social integration seem to buffer the adverse effects of low SES or hypertension. So having that correlation between having more support and being able to actually build that emotional resilience. The studies also suggested that social programs designed to foster social integration, for example, free or low cost bus fare to promote visits with friends and families, may improve health among people with low level education, who are not working, or who have problems accessing medical care because of financial problems. Ford et al. Also suggested that social support coming from the home, school, or neighborhood may also buffer stress and translate to increased successes with health-related behaviors and hypertension. And so, relating back to that quote, hypertension is a social disease that is essentially mediated by the direct and indirect social detriments of health and various factors.
All right, so next we'll be talking about some of the stress reduction strategies that we found and the research behind it and how it ties into hypertension. So for the first one, we have cognitive behavioral therapy. So when looking at stress reduction strategies and managing psychological well-being, cognitive behavioral therapy is often used to help change thinking patterns and develop coping strategies. So on the slide here, it has a little bit of an explanation about how it can be used, and the highlighted red box there kind of summarizes it really nicely. So it says that CBT involves challenging the negative thoughts about yourself and your situation and looking at life differently. By changing your thoughts, you can start to feel better. When thinking about hypertension, cognitive behavioral therapy can be used to modify eating patterns, increase physical activity, and improve medication compliance through correcting patient misconceptions about medication use. The next slide, please. So now that we've discussed what cognitive behavioral therapy is, let's look at the research about how it ties into hypertension. In a systematic review and meta-analysis by Lee et al., which included 15 randomized control trials, it was found that cognitive behavioral therapy-based interventions help to reduce not only depressive and anxiety symptoms, but also reduce systolic and diastolic blood pressure and cholesterol in comparison to controls. Cognitive behavioral therapy-based interventions were also shown to improve sleep quality. However, in the study, they didn't find any significant reductions in LDL cholesterol or triglycerides. But another interesting finding that they had was that group cognitive behavioral therapy-based interventions which lasted more than 10 sessions were found to be more effective and reducing blood pressure, which may be a result of social support from patients in those group settings and longer intervention times that allow for change to occur in patient cognition and behaviors. And then next, we'll talk about mindfulness-based stress reduction, which is another strategy that is used to help decrease stress levels and manage depression and anxiety. Mindfulness-based stress reduction focuses on what is happening in the present moment, combining meditation, breathing exercises, and yoga or stretching. So on the slide here, it involves, like I said, concentrating on the rhythm of the breath, focusing on the 5 senses, detaching thoughts from emotions, and strengthening that mind-body connection. So looking at the research in back to the last slide. So in a systematic review and meta-analysis on the effects of mindfulness-based stress reduction on hypertensive and pre-hypertensive patients by Conversano et al., it was found that mindfulness-based stress reduction was associated with a statistically significant reduction in diastolic blood pressure and a marginally significant reduction in systolic blood pressure in comparison to controls. Looking at these results, they are consistent with data from studies investigating the effects of mindfulness-based stress reduction in other clinical populations like cancer patients, healthcare workers, etc. While mindfulness-based stress reduction appears to have promising effects on the reduction of diastolic blood pressure, in the study, they did note that some limitations are that they require larger, higher quality trials with longer follow-ups. And then on to the next slide here. Another strategy we have for reducing stress is practicing gratitude. So one way that we can kind of incorporate that into our daily habits could be practicing gratitude when we're eating, drinking, or checking the time even. And actually here we have a video by Dr. Curnew about gratitude.
Alrighty, thank you so much, Anna. I actually love this slide because of this little tip that I made myself. So I think it was about a year and a half ago where I just thought, oh, what's this gratitude practice that I can incorporate into my daily habit? And I just thought this idea of habit coupling, where something you already do every day, you attach something new you want to do to your habit. So I thought, what's something I do every day? Checking the time, eating, drinking. So I think over time, if you try to do this in a week, some people do this differently, but if you try to do this in a week, you start to form this association that's completely automatic. Every time you check the time, you think, oh, let me think of what I'm grateful for right now. And honestly, you can be honest with yourself. Many times I just say, there is nothing. I'm going through a bad time, or I'm stressed, I'm thinking about something negative, That's okay. It's not, in fact, that's actually the purpose of being mindful. Whatever the emotion is, doesn't always have to be positive, but it's just a quick and very neat thing that you can do. Some people prefer to write things down. I think it depends on personal preference. Some people prefer to talk it out with themselves, going on a walk, or speaking with other people. But I found this little micro habit, micro gratitude, to be very useful personally. We didn't find research on it, although Jazz, you mentioned that the term micro gratitude showed up on Google, so it seems like somebody else has thought about it. But it's interesting. Give it a try. Think about something you do every day and how you can connect it to something grateful. It just kind of brings you back to earth when you're doing work and you're busy, etc., etc. All right. Now let's talk about exercise. Dr. Curnew, you mentioned sometimes to patients that, or us, that exercise is the best antidepressant, and this is a very good example of that. We talk a lot about research, but I really like this specific slide because of that bottom left diagram that you see. They're comparing data from randomized trials on different interventions: walking, jogging, cognitive behavioral therapy that Jana mentioned, yoga, exercise plus medications for depression, SSRIs or anxiety, aerobic exercise plus therapy. So you can see that the top ones from walking, they have the biggest effect sizes, the biggest impact positively. And we go all the way, surprisingly, the bottom one, SSRIs, medications, are actually the weakest. Now, the reason behind this, I don't know. You can find statistics and show them. But it's very interesting that the walking and movement, simple movement, is all the way up there. And if you look at this small conclusion summary at the top, it says exercise worked better when it was more intense. Now, anecdotally, I can relate to that, but it sounds good that it's backed by research in the literature too. So whatever movement works for you. Something that I learned recently was do what is easiest to you when it comes to movement, because life is a marathon, exercise is a marathon. You want to keep doing it as much as possible. So do what is easiest. And then once you develop confidence, you can do other things, strength training, like what we always stress in the clinic and things of that nature. And if you want some resources, you can type Greg Curnew YouTube, exercise, mindfulness. We have lots of videos, short and long, to help you out. There's definitely no shortage of resources. You just have to find what works best for you.
So if you go back to that
Yeah, go ahead.
meta-analysis, so that's for mild to moderate depression. So if you have severe depression, you might not have the strength to exercise. So I think this is wonderful, underappreciated, and so thank you for sharing that. So yesterday I did some weightlifting before. I played some squash later. I'm thinking, depending what time I get home tonight, I might go for a quick bike ride or I might just collapse on the couch. I'm just not sure which. But I know tomorrow morning at 5:45, I'm lifting weights and playing squash before clinic.
Wonderful. You're keeping active, right? So it's a good thing to reset. And you have some tough days, you have to reset. No, but it's a good pin that you just put in this slide. The slide is from mild depression. That's absolutely true.
Mild to moderate.
Yeah, moderate to
depression.
moderate. Yeah, because there's conditions like severe depression where it's a little bit more serious, it requires professional help, and absolutely, it's good that you mentioned that. All right. Another thing, just from the last slide, because walking was on the top, it's just walking is very simple, very available for many people. Although if you, some of the elderly do have trouble with walking, you have knee pain, etc. So other types of movement might be better, getting, just small little movements around the house, etc. But again, anything helps, any movement helps, not just with mental health, but this study showed that it had a slight effect on your blood pressure management as well. So going back to that very first slide that we have, every 10 milligram of mercury reduction in blood pressure reduces heart attack risk, stroke risk, mortality risk. So this goes back on every little helps up until this point. If it's too low, obviously that can be problematic. But again, the best blood pressure, as you said, Dr. Curnew, 110/80. And, it's just another tool in the toolbox. Okay. Also want to include this slide here. When a lot of people think of meditation, mindfulness, I think they think, do I have to sit like a yoga teacher, like a Zen teacher, and meditate? It doesn't have to be complex. this is my favorite video that I haven't come back to in a while, but I used it for about 2 years consistently. It's just only 2 minutes, a 2-minute meditation. It just reiterates that it's so easy to do it, and that little first minute to 2 minute gives you the biggest benefit. It's just like exercise. That little first 15 minutes is the best. And so meditation doesn't have to be 10 minutes, 15 minutes, just taking 30 seconds out of your day, and just reflect and taking a step back does a lot of good. At first, I thought it was not really true. I get it depends on the person, but if you're having a busy life, stressed, something happens in the middle of the day, I found this to be really useful. I also put this link in the description of the webinar if anybody wants to check it out. But again, it comes back to that micro habit of micro gratitudes, micro meditations, 1 minute, 2 minute. I love it. All right. We also talked about social support. I think this is when you probably ask people, what is your biggest stress reduction technique? This is my guess that many people would say social support, talking with people, friends, family. And so we just wanted to give some very funny examples of social support that you can have. Pets are wonderful. Pets are a wonderful source of social support. Sharing a ginger ale with a puppy. I mean, the reason I put that in there is because it's the little things in life that bring the biggest of joy sometimes. So it doesn't have to be anything fancy, but just those little humorous moments in life really makes it useful. Cats, another one's dogs, whatever. And joining community events. We actually had a body composition event back in May. We're going to have another one August 7th. We're going to tell you a little bit more about that in our next webinar next week. We're going to send newsletters, and you're going to be able to join August 7th. And we're going to get your body composition and have some food, which is the best part. We're going to have that. And the other thing is exercising with strangers, because sometimes going out with people you don't know brings another benefit. Just being outside among other people, it lowers stress a little bit. And if you can add exercise to that, walking, jogging, exercising on a bike, like Dr. Curnew just said, your plan for tomorrow morning is also wonderful. Being with family, and the other thing is, if you have some time on Wednesday nights, you can check out our mindfulness team. They're wonderful. I wish Dia was able to be here today and give us a little bit of a TLDR of her wonderful strategies. But if you want to know more about mindfulness, you can check out our Zoom sessions Wednesday night. Again, the link is in the description of the webinar. If you think it's good to be around a few people and learn from, I would say, experts on the topic, you can join us on Wednesdays. We also have weight loss teams on Tuesdays if you'd like to check that out. That's also in the description. But my favorite one is on Wednesdays, because they cover 3 different important M's: movement, mindfulness, and motivation. 3 pillars of health. Okay, so you can just be like that cat. Take 2 seconds to meditate while you join and do a little bit of exercise, a little bit of movement. And it's going to do a lot of good. And thank you for the webinar, and for joining us. Just to summarize, blood pressure control is one of those challenges in the medicine that it can be beyond medication for some people. It seems like where socioeconomic status affects it, stress, emotional health affects it, lots of things affects it. Again, medications are a tool in the toolbox. Some people absolutely need it, but for some people, just being less stressed, even being on top of medications, does a lot of good. And just wanted to reiterate this. Any thoughts from anybody else, Dr. Curnew?
That was fantastic. Just backtrack to next week's session there.
Yeah.
So on August the 7th, 2024, we're going to actually have a microgreen garden. So we're actually going to show you how to grow a garden with lights and things. And so it's a kind of a new thing for us. Go back to that initial slide about high blood pressure and lowering blood pressure by 10 millimeters of mercury. There we go. This is phenomenal. We know that drug therapy is important, and we know that each drug that you use for high blood pressure can lower blood pressure by about 5 to 10 millimeters of mercury. But we know that lifestyle changes by restricting alcohol. One thing we didn't talk about is the DASH diet to approach to stopping hypertension. lowers blood pressure. And look at the benefit from a mortality reduction of 10% reduction in heart failure, stroke by 30% reduction in heart attacks by close to 20%. This is actually important data. You deserve to know your blood pressure. You deserve to have your own blood pressure machine at some point in time. Maybe you can actually show us on the YouTube channel
Yeah. Absolutely.
our hypertension videos that we have right now, because learning how to measure blood pressure is important. We have a short few-minute video, and we have some longer videos to look at. I'm also impressed that the context of hypertension, where you live, who you live with, um, and controlling your emotions can play a huge difference in all of this. So, and I thank the team for presenting that information. I'm very lucky to have a very rich community of a wonderful office, a wonderful students, and wonderful patients most of the time, and we're all trying to get better. So how would we find something if you go to
Yeah, I was just gonna
youtube.com?
share with everybody. I think the easiest way to find our videos, we do have a playlist, but that's a little bit more advanced. I think the best thing, just go to YouTube, put Greg Curnew, and put a topic that you want to watch. You can put blood pressure. You mentioned the DASH diet. You can just put DASH diet, and it
So if you
takes you
go
to some of the videos. Then
put,
you can
put
check
that
them
little
out.
hourglass if you can, and just put high blood pressure just in there if you
There we
want.
go.
Um, and there you go. There's
Very popular
so
webinar that we had on. So this is similar
and
to the Mediterranean
how to
diet,
measure
it's a low
blood pressure.
sodium diet. It's wonderful.
So you want to measure blood pressure properly, and measuring it with a machine approved by Hypertension Canada. So that's wonderful. So I want to thank the team for a wonderful presentation today. Let's go back to their conclusion slide, if we can. And I think is that you are part of your environment, and I think you guys said it so nicely. Do you think we should end with a few push-ups, do you think?
Sure. I'm gonna beat your
All
record
right.
tonight. Let's go.
Let's see if we can let's see how we can do this over here.
You
All
won't be
right,
able to
here we
see me, but
go.
you can hear me. Go ahead.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 17, 17,
All right, failure at 25.
18, 19, 20, 21, 22, 23.
Two more to go.
23. That's it for me today.
I won today. Okay, good.
Today, every day. All righty. Well, listen, we will see you soon. I want to thank the crew for a wonderful session. And you are your environment. And measure your blood pressure. Have a great night, everybody. And 2 more.